And before we get started, I'd also like to thank, the community. I'd like to thank you. It's been difficult, as most of you know. There's been some viewpoints that are not shared by others, and there's been some things going on, but I'm hoping we could come together as a community, as we always do, and do what's in the best interest of our students, and protect them in the process, and make sure they get that high quality Wayne Highlands education. I'd like to also thank, the administration, the teachers, the staff, and everyone who has just put countless hours into trying to develop the plan that's going to follow our Wayne Highlands way and make us what we are. And so we can look and feel like Wayne Highlands in this difficult time, and these trying times. So keep that in mind as I get started. As we get through the PowerPoint, it should take me about 45 minutes or so to get through the PowerPoint. I'd ask that you just hold off on your questions for the chat until I get through most of my PowerPoint at least. That way I could probably answer some of your questions before you have to ask them, and we won't have to double up. I would ask that you be patient as we get through it, because there's a lot of information that's going to be given to you. And there's a lot of questions that you may have, so I want to give enough time at the end for that. All right, Mr. Miller, we can get started. Thank you. So, we'd like to talk about our school reopening plan. And if you haven't had the opportunity, I would suggest you go onto our website and check out our full health and safety plan for the district. It gives, what will happen in each phase as the governor has outlined for us, whether we're in the green, yellow, or red phase. Right now, we are in the green phase. So we are going with a reopening, but you do have some options, which is what I'm going to review with you here tonight. There are 3 options, and they're all very good options, and it comes up to personal choice and family choice. So I hope you would keep that in mind. And I hope you would also keep in mind that, I don't know if you could see behind me, but I do have 4 of my own. So I understand what you're going through. I understand at such a young age sending them. You may have some reservations, and I'm hoping I could put some of those to rest, and I'm hoping that you can make an informed decision based on what I present to you tonight. So, on that website, we do have our timeline of what we've done and how we've done it as an administrative team. And also on that website is a Wayne Memorial Hospital video. I would suggest you watch that. That is a fantastic video. And they have been a fantastic partner with our school district and all the W's, Walpole, Western Wayne, in coming up with plans that are safe, that are effective, and that meet the needs of all of our students. We have been working in collaboration with the Pennsylvania Department of Health, Wayne Memorial Hospital, as I mentioned, the Center for Disease Control, PDE, the other local districts. Our superintendent and assistant superintendent have been meeting with other districts to try and find a uniform way of delivering instruction, and with the IU-19, which encompasses, even the Valley district. So everybody has been working on this together as a collaborative effort. It may look different a little bit in some districts, but the meat of it and the health and safety plan looks familiar for all districts. With that being said, our mitigation musts, the way we have to control this is, we have to socially and physical distance. I know there's some differing opinions in the community, but for the sake of safety for our staff and students, we need to physically distance in school. We need to mask if we're less than 6 feet apart, and we need to wash our hands for 20 seconds and sanitize our hands with soap. All of these things are going to be reviewed with you as we go through the plan and the highlights of the plan and your options. Mr. Miller? So there are 3 options for you coming in this year. We do have our option number one, which is traditional learning, which is what I'll spend most of my time discussing as far as, our health and safety protocols and the things we will be doing for that in-person instruction in the building. So the traditional learning consists of, a health and safety protocol, which is a top priority. Excuse me one second. We are going to maintain in-person connections with teachers and classmates. Students will attend school Monday through Friday in person. Transportation and lunch will be available daily, including breakfast. All the benefits of a quality Wayne Highlands education. Everything you've come to know about our district will be implemented with fidelity, and we will do everything to make sure the health and safety of the students and the staff is top priority. That responsibility comes from all areas. It comes from home, school, administration, and community. So we're looking for all of those things to play a part together. Our second option would be Wayne Highlands Live, learning in the virtual environment. Some of you are familiar with the way we ended last year from March to June, which was a difficult situation. It came on us so fast that, no matter your thoughts, the way the teachers came together and everyone came together to make it happen was truly amazing to see the things that did go on. This year, we are offering the Wayne Highlands Live. And what that is learning at home with your child's Wayne Highlands teacher. This is the difference of how it will look from how it looked in the spring. Instruction is both live, which we call synchronous, so you are interacting with that lesson. The camera's on the teacher's teaching the lesson. As that teacher finishes the lesson, they will have the option of either turning that camera off and leaving the sound on, or just leaving the video facing, the front of the room. Students will not be on camera, but the teacher will be circulating. If you are choosing this option, your child will have the ability to answer questions, show their work, and all of that in a live environment, just virtually. It's an identical curriculum and instruction as in the Wayne Highlands and what their peers would be taking in this brick and mortar setting. And the virtual engagement and interaction with the Wayne Highlands teachers and classmates. That's a big selling point. So, if you do choose that, and when the opportunity arises for you to make a decision again, which would be the end of the first quarter after 45 days, if you decide to come back to that traditional learning, that brick and mortar learning, it would be a seamless transition for the students because they would have been working with their class and with their teacher synchronously or asynchronously. And we'll get into that a little bit more also. Our third option is the Wayne Highlands Virtual Campus. We have had that for a few years. It is an online education program in coordination with the VLN partners. They're the ones who run it. VLN is contracted out through us, but they run the curriculum that we have directed them to run for our Wayne Highlands community and our students. It is aligned to our courses of study in our elementary schools. It's math, ELA, and specials are provided. Local connection through Wayne Highlands Liaison, which is Mr. Roos, who is probably on our Zoom meeting right now. I haven't checked participants, but he always joins, and we thank him for that. If you have questions on that, once we get there, I would ask you to reach out to Mr. Roos or myself, and we can answer those, independently. Also, please remember that the invitation went out today, and I'm hoping most of you got it at this point, for your educational declaration. So you have a window of today through August 10th to make that decision. After you see my presentation and ask your questions, I'm hoping you'll make the informed decision that's best for your family. Once you make that decision, it will be for the first academic quarter, which is 45 days, which I discussed. So there won't be the ability to transfer back and forth within those 45 days. But there will be a window opportunity after 45 days and after 90 days and after, the third quarter, if needed, that 135-day mark, if needed, if we're in the same position where we are now. Hopefully not. Okay, Mr. Miller, thank you. Go on to the next one. So let's talk about option one, the traditional learning, that brick and mortar part of it. So we will have to have masks on all district transportation and upon entry at school. So what does that mean for you? I'll get into that a little bit later for parents and their part in this and helping their students transition back to school. You know, they've been off for a while. I know mine have been off for a while, and we all know that as parents. But I hope there's some of our little friends out there listening now that know that we have their best interest in mind, and we have our teachers who are ready to go and who are very well versed in COVID and very well versed, of course, in their instructional processes and how it will work in their classrooms. Sanitation stations at all large group areas. We'll have them at entry and exit doors, classrooms, cafeterias, playgrounds, basically all around the building. So students will have that opportunity. There will also have mask up and mask down time throughout the day as needed. Right now, we are, depending on numbers, when we get those educational declarations, if we can maintain that 6-foot distancing, within the classroom in first and second grade, then the students will have the opportunity to take their masks off at their desks, as long as that 6-foot distance can be met from student to student. If a student gets up to sharpen their pencil, if they need to use the bathroom or they need to get something from the teacher, it will be mask up time, because then they will be, you know, out of that 6-foot radius. So they will have to mask up at that time. Our lessons will be focused on mitigation strategies to begin the year. Of course, our kindergarten, you know, will be focusing on it very, very much because they're new to the school. Our first and second graders are familiar with the school for the most part, most of you, and you know, it will be just a matter of showing them the distancing, what they have to do, and going through the protocols that we have in place at the school. Lunchtime. So lunch, we're going to utilize a couple different areas depending on the numbers. We have to keep them 6-foot spaced so they can eat, because they need to have their masks off, obviously. So we are going to utilize the cafeteria, our foyer area, there'll be tables set up, and our gymnasium as needed to accommodate that social distancing. Right now, with the numbers, we're looking at maybe students who bring lunch in the gymnasium and students who are getting hot lunch in the cafeteria and that foyer area. But again, it depends on numbers and where we can fit everyone. If it's possible to keep everyone near that cafeteria, we'll do that, cafeteria and foyer area. Playground usage, we will be utilizing the playground independently as a class for recess. Teachers are working on developing, you know, their staggered scheduling as far as their mask breaks, going outside, using the bathroom. I'll be working with them closely to make sure we have it all set up and everything works together as a school, because they're working with their teams in second grade, working with their teams in first and kindergarten. And what I'll do is take it all and put it all together and make sure that there's no overlap. Reduced items from home, I guess you can say whatever you carry in, carry out is the old phrase. We'd really like to not have extra things coming in. Our cubbies are close together. We're going to have to find alternate spots for students to keep their materials, maybe under the, we're looking at under the built-in shelving, that everyone will have their own little spot to keep their stuff. Backpacks just put in there and they will stay there. Anything that comes in, we're asking goes out. So, you know, extra things we're trying to avoid. Like I said, reducing items from home because of that limited space, and reducing transitions during the day. You know, we're going to have our specials in the classroom. We're going to have separate bathroom breaks by class staggered. We're going to have separate staggered dismissals for lunch. Beginning and ending the day will be staggered to avoid large groups. I'll get into that a little bit more as we move forward with this traditional learning. Okay, Mr. Miller. So arrival and dismissal. We're encouraging you, if you can, to drive your student to school. You know, that is not mandatory. Transportation will be provided. but it would alleviate some of the crowding on the buses. But again, it's optional, but we are encouraging it. So the parent drop-off procedure will remain the same with social distancing in mind as you bring your child to the entrance. So again, if you're dropping your student off in the morning, you would park down, and we are opening at 7:30 again, same time. You would pull down into the main parking lot where you usually park, and I would ask that you mask up to walk your child up to the doors, and they will be taken in from the teacher from there. Okay, so that mask is just a precaution because, as you know, if you've dropped off kids before, we do get a line coming up together, and we just want to make sure that everybody's distanced safely. Breakfast will be available in the morning as a grab and go as they arrive. So as the students come in, we will have a station set up in our foyer area with a table, a laptop, and a scanner. And on each bus tag, students will have their ID for their lunches and their breakfast, as they usually do. They usually put in a code. We're trying to keep everything hands-off this year. So as they come in, if they want to grab a breakfast, it will be cold breakfast, at least to start, and it will be bagged. They can grab that, and all they simply have to do is turn around, and their tag will be scanned, and it will go right into the computer for them. So there will be no need to go into the cafeteria, go through the line and re-sanitize that. As we look at numbers, again, and you'll hear me say that a few times, as we look at numbers, we are looking at, where students who enter between 7:30 and 8 will be stationed. So normally we would use the cafeteria for all kindergarten. First and second grade goes down to the gymnasium and waits for the bell as other students arrive. We will be looking at smaller areas. We will be looking at, or we are looking at and have done social distancing on the bleachers, and it's marked off for students. If we have more students, if we have the number of students that are registered and are coming back brick and mortar, we can accommodate that. If it goes down to less students, if some people choose a different option, then of course it would be more accommodating for those students to meet that social distancing requirement. Dismissal to buses and parent pickup will be staggered to avoid large groups. I would love to give you a schedule right now of what times they are going to be happening and what time your bus runs will be happening. It's just not set yet. And again, until we get those numbers and who's riding and what transportation, we won't have those times yet, but you can bank on us staggering those things and avoiding a bunch of kids coming down at once. So in other words, for our parent pickup, it may be, we may be calling kids from the room. So your wait may be a little bit longer in the beginning if you're a parent pickup, which we are encouraging too for transportation, but the wait may be a little bit different. And what that exactly looks like, we're still working on it until we get that transportation set as far as buses go and timing. Okay, Mr. Miller. Health and safety protocols, and I do have Mrs. Howell on with us, our nurse, and many of you probably know her from the community. And she's here, in case questions arise that she's the expert in. I'll do my best to answer them, but if you do have those questions, we'll put them in the chat box and she can chime in. And of course, she can chime in anytime you want, Mrs. Howell, as I'm going through these health and safety protocols. So the nurse will maintain close contact with students with vulnerable medical needs if they are coming to school. I would caution you if there are severe needs, if there are severe and vulnerable needs, it might be worth exploring, the other option that I'll be going over next, just for the health and safety of your own child. And that's a family decision you'll have to make. But as you're here, we have the medical record from last year. If you're new, we'll have those. But, get in touch with myself or Mrs. Howell if you have questions that are personal and that are, geared just towards your child. And we will meet those needs through the nurse and through the nurse's office.
Yeah, any specific questions you have, just email me. I've received some emails already from parents, and my email is on our website, so just reach out.
Thank you. Sanitation stations, sorry, I just did an hour and a half of these. Provision of hand sanitizer and disinfectant, ample opportunities to wash hands. We talked about that. We are going to have breaks. I will be announcing it over the PA system that we will be taking, breaks now to sanitize, to maybe a mask break, to things that we need to do for the students to keep them, healthy and stop the spread of any kind of germs or things of that nature. So, we will have those announcements throughout the day as reminders. Heavy cleaning protocols are in place and have been in place during the day and overnight. Foggers, electrostatic foggers, they call them. Deep cleaning, high touch areas, your handrails, your doorknobs, the areas that students touch most during the day will be done deep at night and continuous during the day. We do have an extra custodian coming on to the day shift who will be helping out with that disinfecting as the day goes along. Bring your own water bottles. The water fountains are disconnected, so I would ask that you send your student with a water bottle. We're asking that it be water for that, trying to avoid any kind of sugary drinks or things like that. But since our water fountains are disconnected, we are looking at different options to refill those bottles for the students. And once we know that, or once we have that in place, I will let you know. There's a couple different options. I know the middle school does have the touchless refill stations for water. We're not there, but we do have some options as far as fresh water goes. Training and signage regarding mitigation strategies. So I will have signs up throughout the building, in the front of the building. I have ordered hallway markers and common area markers for the floor for social distancing of 6 feet. We can move through the hallways at 3 feet because we will have masks on as we're moving. But that 6 foot distance is just there because that is what everybody's used to seeing. So again, 3 foot distance is acceptable moving through the hallways with that mask on. So we did do, every hallway will be a different animal footprint. I think first grade are eagles we ordered, and then we have, I believe it's bear claws for second grade. So they'll know their hallway, they'll know, which animal they are, and then when they get into the common areas, there'll be signage of children's footprints. So as not to be confused, so they can just walk on them. Anyone can walk on those, but it maintains that social distance going down to the cafeteria, out to the playgrounds, and down towards the gymnasium. Ample mask breaks when 6 feet of separation is not possible. If we get into a situation where some of the classrooms are not able to be 6 feet, we're going to have to look at taking many mask breaks during the day to let them socially distance, take their masks off, and give them that break. Right now, we're hoping that with our numbers coming in, we're going to be okay 6 feet distancing them. If our numbers go up a little bit, it might become an issue. And I'm just going to be totally transparent with you. It might become an issue, and we're going to do our best to keep that 6 foot spacing though. I did have all of the teachers take most of their furniture out. So they're left with bare minimum, unfortunately. So if there's teachers on here, I'm sorry. You're left with bare minimum furniture in the room so we can get that floor space in so we can separate them 6 feet apart. If a positive COVID-19 test comes in, we will be collaborating with local health officials, the Department of Health, Wayne Memorial Hospital, and it will be on a case-by-case basis, the steps we take when we do get that in conjunction with Patty, our school nurse, and the Department of Health. We will make that decision and be contacting them so they can do if they need to do contact tracing, or we need to shut down a room or a hallway or the entire school. That will all be determined on what our health officials are telling us what to do at that point in time. Next slide. Thank you. And so I talked a little bit about those parent expectations for option one for bringing them back to school, and how we all kind of play a part here. And you know, this is where some of those things come in, where belief systems are a little bit different about, you know, what's happening, the amount of tests, the amount of people who are affected in the community, you know, and your feelings about it. But right now we have to, for the safety of our kids, since it's such an unknown, and the safety of our staff and our students, I need to ask you to do a few things at home. And the expectation is that you'll follow through with these things, because it is important, because we can't have bus drivers. Bus drivers will not be doing temperature checks and symptom checks as they get on the bus. Students need to be masked up when they're boarding that transportation. You know, if they're at the bus stop and there's two kids without their masks on and they're first and second graders, well, that bus driver, you know, is not going to stand there and argue with them to get their masks on. So part of that responsibility is you working with them to get those masks on as they board that transportation, and leaving them on as they board that transportation until they arrive at school and they can maintain that 6-foot distancing. So the daily symptom check, Mr. Miller, if you could jump ahead a slide for a second. So that daily symptom checker and the screener from the Pennsylvania Department of Ed, if you look at that, there's two groups. Group A, if you're exhibiting one of those symptoms, you know, that fever of 100.4 or higher, a cough, shortness of breath, or difficulty breathing, we're asking you to keep your student home. We're asking you to consult with your doctor and get them in if you can. In Group B, we're looking at if your child is exhibiting two of those symptoms, we're asking you to keep them home also, and make contact with your healthcare provider. So, you know, the sore throat, the runny nose, congestion, chills, things that, you know, may signify a flu, we know that, but, you know, may also be something else. New lack of smell or taste. You know, as I went through my last meeting, I think we should probably move that one over to Group A, because it's becoming such a hot topic and such a real, you know, indicator of COVID, is that lack of smell or taste. So if you're seeing that, you know, I would say keep your child home, contact your health professional, let us know what's going on, if anything is going on, so we can make accommodations as needed. Muscle pain, nausea, vomiting, headache, diarrhea, those things that probably at this age you would wind up keeping them home anyway, but just as an extra precaution, you know, screen for those symptoms in the morning before they go to school, and make sure that they don't exhibit any of those. Is there anything you'd like to add to that, Patty?
No, but just, you know, just reinforce the importance of us as parents doing, you know, checking at home in the morning before we send them off to school. It's just really, really important, because Tony will get into it, but we will not be doing temperature checks when they come in the building. It's not best practice. And so it's just us doing those things at home. Just doing our job as parents is really important.
Thanks, Patty. Scott, can you bump back to the last slide, please? Thank you. So, knowing that, when we were talking about masks, the hot topic, I came across, you know, as I was doing my research on some of the things, because, you know, I have 4 of my own. They're older, but, you know, I remember when they were younger. My youngest is 11, but I remember being, you know, kindergarten, first, second grade, and I can imagine the difficulty of trying to keep it on my own kids as they enter school. So I do know what a lot of you are thinking. I know how difficult it may be. So some of the suggestions from the American Association of Pediatrics were what you see in front of you. So put a mask on a favorite stuffed animal. You know, our second graders are still young enough to do that. But, you know, in second grade, if you want to put it on the child and act out a trip to the school or grocery store, take them in the car, go somewhere with that on, and then praise them or the stuffed animal for wearing it the whole time. You know, show them that it's okay. I think the biggest part of it is, you know, we're out in public and we feel uncomfortable with that mask on because we're not used to wearing it, and we feel, well, it feels a little strange, and I get that. and if it feels strange to you, it's going to feel strange to your children too. So we need to start working on that before they return to school. Gradually have your child wear the mask for a longer and longer period of time. With the little ones in kindergarten, I suggested it a minute or two at a time, but as they're getting older, first and second grade, and kiddos, if you're out there, I hope you're listening, start with maybe 5 minutes, and then 10 minutes, and increase the time from there until they can wear it for 10 minutes or more. And that's not just in the stores or if you're going shopping. I'm talking about those situations where you don't normally have a mask on, because school is not normally the place you would have a mask on, and our first and second graders know that. So, knowing that, maybe practicing at home by you wearing a face mask around the house and showing them that it's normal, that it's what everyone's doing. It's okay to do. Take selfies, have fun with them, show them how they look, do a Snapchat filter with it on, do something like that so they can laugh and they can joke about it. And let them know they're doing a great job. Let them know they look like a superhero when they're wearing it. I have someone doing up some masks for me with cartoon characters on the front. I'm not expecting you to go out and buy those things, but we all know how much they like their superheroes, their cartoon characters, all the things that they enjoy watching on TV or watching on their tablets. Things like that to get them interested in it. Just use that. Use your discretion as a parent of what they like and build upon that. Print out pictures or find pictures online of their favorite characters, like we were talking about, while they're wearing masks. I tried this. I went on. There's a ton. You would be surprised of how many pictures there are with people with masks on. Superman pictures to Spider-Man pictures and all that. Go online, show them those things because everybody's taking part. And offer a small reward. People ask me all the time, aren't you bribing them? No, you're not. It's a behavioral technique. It's okay to say, you know what, you did a great job. Here's 10 extra minutes on an iPad, or, extra time outside, or, play a game with mom and dad, or read a book with mom and dad, or, just whatever they enjoy doing, but give them a reward for that. We want to get that gradual build up to school. So the sooner you can start, if they're coming back in person, the better. And I would say, like tomorrow, just start little tasks at home with masks on. Next slide, please. Okay, so option 2 is our Wayne Highlands Live. As I said before, those of you who are familiar with what we did in the spring, this looks a little different. There's been some confusion, so I want to take a little bit of time to describe this to you. So, we as a district, in collaboration with, all the other departments we discussed, we wanted to give an option to parents because, overwhelmingly, if you look at the survey back when it was given early, overwhelmingly parents wanted students to come back to school. As we know, things have changed a little over the summer. We thought that they were, numbers would go lower, but in some areas they're going higher. Thankfully not here, but some areas they're going higher. So, we wanted to give that option to parents because we know, with our students, they're our kids. We want to do what's comfortable, and we want you to feel comfortable getting that Wayne Highlands education that you've come to know. So we have our live streaming interactive virtual education. So what that is both a synchronous and asynchronous model. What does that mean? That's a crazy word, right? So synchronous is when, the teacher is providing live instruction. The teacher's in front of the room. The camera's on the teacher, not the students. The camera's on the teacher delivering that lesson. Okay, so in a lecture environment, like a high school or a college, that's pretty easy. That's pretty easy to do. We can keep them there. They can look at the teacher. We can keep the camera on them the whole time, and then they can work. When we're dealing with self-contained rooms and we're dealing with younger kids, there's got to be a lot of circulation. So what will happen is in that live portion, your child will be tuning in live, getting the lesson from the teacher live in real time, able to ask questions, get their questions answered, and participate with the other members of the class in that discussion. Now, they won't be able to see the other members of the class, but they'll be able to participate in that discussion. So that's the synchronous model. The asynchronous model is a recording of either that lesson or a lesson that the teacher recorded at another time and put up on the Google Classroom. It will follow the same curriculum spiral as we're doing with the synchronous learning, but it will just be on your own time. In other words, if you have to go to work or you need to have childcare, you're not comfortable with your child coming back, but you still want them to have that Wayne Highlands education, it gives you the opportunity to wait until you get home and work with your child, you know, on the Google Classroom with those lessons, with a teacher, giving those lessons, not simply posting up work, but having that instruction delivered to your child and you. If you choose that model, you can do either. So when you get your survey, if you want to do option 2, that includes both synchronous and asynchronous. And let's say that morning you have to go to a doctor's appointment and there's a lesson happening at 9 o'clock and there's no way you can make it. Well, you simply do the asynchronous for that day. So all the work that you have will, you know, all the work the student gets will be, you know, everything they do will be put up onto the Google Classroom. And if their assignments are complete, that is how we're going to take attendance for students. So it's going to be through their work, not as they're logging in live, if they are logging in live, and not, you know, any other way except for the work. There will not be paper packets as we've had in the past. Everything will be digital. If you need access to any kind of electronics, anything to make this easier for you, we will do our best to get it to you as it's available. Just reach out to me and let me know. There will be no enrollment change for option 2. In other words, you're already enrolled. We have you in our system. It's just a matter of you answering that, and then we'll get you moving in that live program. So you don't have to do anything else but answer that survey. So you would indicate option 2 on your survey between now and the 10th, and that would put you in that. Once you're in and August 10th hits, that's where, you know, you will stay for 45 days. So your first quarter of school, after the 45 days, you will have the opportunity to, you know, come back in to the brick and mortar setting and our traditional plan, and it will be seamless because your student has been seeing that teacher on a daily basis, completing those assignments on a daily basis, knows what kids are in the classroom, and, you know, as they come in, it is the most seamless option that we have out of the 3 if you're choosing to go virtual. Okay, Scott, next one, please. So option 3 is our Wayne Highlands virtual campus that I was talking about, and that's our coordinator is Mr. Roos, and he would be the one to answer any specific questions you have on that. What I can tell you is run through the Virtual Learning Network, or VLN, and they're contracted out with their own instructors. Our curriculum has been given to them, and they follow our curriculum. It does not go at the same pace as our live program, but it does cover all the areas that we need it to cover as far as standards are concerned. And it is asynchronous. So you know, just like I told you before, you can do it whenever it's convenient for you. If you are interested in that, that requires a separate enrollment. And I believe it would be ELA, math, and the specials are included in that. Again, not Wayne Highlands teachers, but they are included in that program. So if you are interested in that, please contact myself or Mr. Roos. His information is up there through email. If you want to take a snapshot of that or you want to write it down, just so you know if that's something you're thinking about. The benefits and drawbacks, I think I covered pretty well as far as the transition back. So as I look at it academically, which is how I look at everything when I'm behind this desk, is, you know, we're looking at them coming back in exactly the same place as their peers. So we're looking at that transition being made at the 45-day mark, the 90-day mark, the 135-day mark. Will be your 3 opportunities if we go that far, if it's needed that far into the future to make that transition, if you did go that route. Same thing with the VLN. If you wanted to move over to a different program, you'd have to wait that 45 days. Okay, Mr. Miller. So your next steps is to complete the parent survey, as we talked about a few times, between now and the 10th. The full registration procedure, if you are exploring option 3. So if you do decide you're going option 3 and you do put that down, you will either be contacted, or you can contact us if you want some information on it a little bit more, and we'll get you enrolled in that. But that does require another registration process, because it's almost like a separate school within the school. No further registration option for 1 and 2. So if you're in, you're in. You choose that virtual live or that traditional learning, you're already in. You don't have to do any more paperwork as far as that goes, as far as enrolling. And I would encourage you to follow our social media pages and websites for updates. We're putting out as much as we can. All those things I discussed in the beginning are there. You can look at them. I encourage you to read through our plan. Like I said, if you're having any trepidations about sending your child back, look through the things that maybe I didn't cover, or you have questions, that come up later. I'm here. You call me. I'm here usually between 8:30 and 3 every day. You can call me. You can shoot me an email. All my information will be, I believe, on the next slide. Scott, if you move forward. Are we there? Yeah. So all my information is there. The school number is there, and my email address is there. Anytime. I know Mrs. Howell's available, by email anytime. Just, shoot her an email if you have questions about health for your child that's specific to, someone in your family or the student coming back, and we'll help you and we'll walk you through it, and we'll try and guide you in the right direction on what may be best for your situation. So, having said that, I'm going to ask Mr. Miller to throw me back on video. I know you probably don't want to see my face, but here I am, and I'm going to go through the chat. If you have questions, you can start typing them now. I'll go through them as best I can and hopefully answer, everything that you ask. So let me pull it up. Okay. So this is, I'm going to answer these separately as I go through. So my question is, will technology be available for students who do distance learning? If it is needed on a case-by-case basis, we can accommodate you as long as we have the technology to do so, and I believe we do. So yes, that is an option. I have 2 children. If we do the synchronization option, will each child have a computer assigned to them? So those are some questions that maybe, if you are looking at that, give me a buzz, or I can put you in touch with our technology, and they can let you know what your options are there. If we are doing a portion live, will it be a continuous period, or will the students have large breaks between live instruction periods? There will be breaks in between instruction periods. And that we are not asking students to sit in front of a computer for 5-6 hours a day. So those transition times, those lunch times, those other times, if you're doing the synchronization, and remember, they're both. So you have the option of doing it if you choose option 2. They don't have to be on live, but it is beneficial for them to get their questions answered. So if that does happen, then they won't have to sit there the whole time, but if they're there, the expectation is they'll participate in the work that's being delivered. The teacher may say, okay, hold up your board and show me what your answer is, and they would be able to do it right on the camera there. So it looks like technology most on that question. Are the classrooms set up so that there's space between students during lessons? Yes, 6-foot distancing we're trying to maintain in all the classrooms. If it's not able to be maintained, we will let you know. But as of now, it is. If a sibling has these symptoms, is the expectation that all children will stay home or only the symptomatic one? If a child comes to school without a mask, will one be provided? Yes to the mask. We do have extras. We will have the lanyards for lunch that will have their code on it for their lunches. And in addition, there'll be a clip on there that they could clip their masks to for that mask downtime and just toss it over their shoulder. So that should help with the losing. As far as the symptoms for a family member, I'm going to say to err on the side of caution, yes, but I'm going to defer to Patty if she has something different.
Yeah, I would definitely err on the side of caution for sure, and just immediately reach out to your child's healthcare provider and talk it through with them. But yeah, definitely err on the side of caution in that situation.
Thanks. We got a hi, Patty. So there's a hi, Patty.
Hi.
Will the mask breaks be inside the school or only outside? They will be inside and outside. So I have instructed my teachers to utilize outside as much as possible. I'm working with Lakeside a little bit to make sure that we have, sectioned off space that we can use, and we want to make sure they have enough and we have enough. But I am encouraging the teachers to go outside and do a lesson every once in a while if they can, because we have heard that, outside is is a good option for the students. If they're masked and they're inside or they're socially distanced, that's fine. But if we can't meet that 6-foot need, we would get them into a bigger space to get those mask breaks. Are face shields acceptable? Face shields are acceptable. They've been proven not to be as protective, but they are accepted by the CDC. We do have teachers who will be wearing face shields, but they will also be masked up in certain situations. So yeah, they are acceptable. To answer your question, you can use those. They can come in with those. Will synchronous lessons also be available asynchronous? So yes. But the caveat to that is it may not be the exact same lesson. It may have been recorded, it may have been recorded on a teacher's prep, or maybe they recorded it, somewhere else and they're just putting it up on a Google Classroom. It will cover the same material, but it won't be that exact same lesson in all cases. Sometimes, they could, the option's there for them to post their live lessons. That's a great question. Will textbooks be handed out for classes? We're trying to do our best to keep it materials to a minimum. We do have the ability to do our most of our math work online. We have all the links for online, and we can project everything up there that the students will need. If they do have textbooks, they will be their own textbooks. They will not be shared. Any sharing of books, those books will go in a separate pile after someone else uses it. If someone uses it and it is a shared book, it will go in a pile. Let's say they have a library in their room. We're going to put those in a pile. We'll disinfect them, and then they will be able to be used the next day. So yeah, the textbook thing, we're doing our best to keep everything more digital, which is a good thing. It keeps things moving along for the students too, and they get a little bit more exposure to that technology, which is important. Will distance learning be strictly Monday to Friday, or can we use the weekends also? Yeah, absolutely. So, once it's determined, if you're doing asynchronous, then once it's determined what day work will need to be handed in, you can take any time you want to do it. I know I have a high schooler who would be doing it sometimes, last spring at midnight or 11 o'clock because it was the quietest time for her. So yeah, that's an option for you. You can do it whenever you want. It just has to be handed in by a certain day. What would be the quality of the synchronous and asynchronous feeds? Audio. How will this chew up our data cap for the month? Okay, so I can tell you one thing. As far as audio goes, it will be clear. I think maybe we may have to look at, and Scott's the expert in this on the other end, but we may need to look at background noise and if that's interfering when we're streaming these live lessons. As far as the data cap goes, Scott, if you're there, you're more than welcome to jump in, but I can get you that answer if you need it, if Scott's not available to answer that. Go ahead, thanks.
If you'd like, what we're working with our teachers for, they've been going through different trainings throughout the summer, but as far as the use of the data caps and things like that, we are as a district trying to work with everyone. And I won't say we'll provide internet service, but we will have options through different providers, depending on where you live, to be able to help you navigate that. So there is some unlimited plans that are available to students and things that are out there. And we're working with all the major providers that we will certainly work with you on that. Also, when you do audio only with Zoom, it doesn't eat up a lot of data. Video, it's very compressed now, where it's the same data as if you make a phone call these days. So things have improved drastically on that.
Thank you, Mr. Miller. I appreciate it. Let's see. The synchronous and asynchronous options are only for students that have internet, correct? What options other than in-person is there for us without internet? I know Mr. Miller just said that he will work with you. There are some options available. I think he answered that. And if you do have questions about that, I would say contact Mr. Miller. You can email him or give a buzz over. But that will be something that, we will work with you on as best we can. Also, how well trained are teachers to deliver on-camera lessons while having to split their focus between the camera and the students in the class? How does it compare to option 3 as far as virtual teaching savvy? So, in the beginning, I said I'd be transparent. In the beginning, it may be a little uncomfortable for them, but, I've seen our teachers, just come up and rise to the top for so many different other things. I think once they get used to it, they're going to be, it may take a lesson or two, and I think that's really only it. It will be fluid at that point. I think they'll get to the point where they won't even realize the camera's on. So they are savvy, and I have 100% complete confidence that they will deliver that instruction as it needs to be delivered. So that's not even a question, but that it is a good question. But in my mind, it's not a question of how they will do it. It's when, everything comes together, how well they will do it, and they will do it well. But thank you. If we pick option
Deneen,
one,
my bigger question was comparative to number 3. How would that compare? Because number 3 is something that you guys contract with people who are designed maybe or trained to do that. Okay.
Correct. Yeah. So yeah, thanks. I'm glad you clarified that. But so our our teachers, no, they haven't been virtual teachers, but we have been providing professional development. We will be providing more professional development as it goes on through our in-service programs and things like that to help them be more comfortable with it. Are the people who are delivering VLN more adept to doing it online? Yes, because they've been doing that for a long time. The difference is, and Mr. Roos, I may defer to you on this one, and I apologize, but I believe the difference that we're looking at is we're providing both of those options, both synchronous and asynchronous, with that live streaming. So even if a teacher is maybe feeling a little bit uncomfortable as they deliver that instruction, they have that option to they can even record that lesson on their own and play that lesson during the class to that virtual student and to the class at the same time. So there are different methods that we can handle that. But yeah, I believe they will be savvy with their professional development and what we provide to them.
And that helps. Thank you. I just kind of wanted to be able to make the decision as an informed parent, maybe even looking at an example from option 2 and an example from option 3. That might help us in a way.
Yeah, and that might be an option that we can pursue and look at. Right now, it would be difficult to put together, but yeah, I understand where you're coming from. I think if you want, I don't want to spend too much time on this, but if you weigh the benefits versus the hindrance that may come about from it, having that student in that classroom and having that teacher have the ability to deliver that instruction live, whether they're savvy, not savvy, they're going to become comfortable with it. We all know it's difficult to be on camera. Well, I don't know if you do, but I have a difficult time on camera and teachers have a difficult time on camera. So, but as in typical Wayne Highlands fashion, we will see that lesson being delivered correctly. I'm not worried about the lesson delivery as much as, just that interaction between student and teacher and their ability to handle it. But like I said, I think there will be options there for them to do it very well. If we pick option 1 and our child is sick for a day, can they do the live option for just that day? So that hasn't been set in stone yet, but I don't see an issue with that. I think it's actually good if they're able to go on and at least see the work that was completed that day. So, that access to that Google Classroom, it will probably be available to those students who do choose option 1. I mean, I wouldn't want to hold them from their education, and we are asking them to stay home if they're sick. So I don't see an issue with that. If there is, I will let you know. If we choose in person for the first 45 days and want to do live after 45 days, can we? Absolutely. Yes, you can. That's not a problem. You could go either way, back and forth after that. Is there a maximum number of kids per classroom? Well, yeah, but we've never met that as far as the district goes, and our regular instructional delivery when we're not in a COVID crisis. We do have limitations on the numbers, but we haven't met that. So right now, we're looking at somewhere around 22, 23 kids in first grade and maybe 20 or 21 in second grade in each classroom. But again, depends on numbers on people's choices. If there's an explosion in a classroom, will the whole class stay home for 14 days? Will distance learning be an option? If that does happen, distance learning will be an option. But as I said in the beginning, we're going to leave that to the health professionals on how we should handle each situation that does come up. But that will be available if they do have to quarantine. For the life skills and ASD rooms, will there be accommodations made for those kiddos where the masks are concerned? Yes. And what I would ask you, if you do have a special education student and you are concerned about that, give me a call. My last job was in special education as an assistant director. I may be able to answer some of those, but I can also put you in touch with Mr. Blaskowitz or Mrs. Kerna to help you answer some of those questions. I know she has ordered some stuff for those classrooms. So she has ordered some face shields and things like that as protection and some plexiglass separators. But if you do have specific questions, please call or email. What measures are you taking to improve or enhance ventilation? Okay, so filter changes have been happening. We are allowing more fresh air into the building through our HVAC system. We are asking teachers to open windows when feasible to let that fresh air in. Those areas that don't have windows, and I don't believe there are many for classrooms, that temperature will be controlled in those areas, and the HVAC system and filters will filtrate deeper into those areas. So our system is set up to let more fresh air in as needed. Great question. When will we know who the teacher is and what is needed? Another great question. So normally our teachers send out letters to students and parents. We will be providing a list of materials. I know I will as a whole, and your teacher, whoever your son or daughter gets, will also be providing some things that they will need specific to that classroom. As far as class lists go, it will be after August 10th once we get all of the educational declarations in, and we can figure out numbers and space those kids equally. So, an exact date, I'm not sure. I'm hoping within a week or two after that August 10th date will be ready. I don't know when they'll be released to the public though. That hasn't been decided. When will teacher and supply list? Okay, we got that. Will specials be live for option 2? Yes, they will. Specials will be taking place in the classrooms. So they will be doing the same thing as the classroom teacher would be doing. The only caveat is, as far as the live goes, I have to work with the phys ed teacher and see how best that can be delivered if he's moving much and keeping kids out of that video feed. So that one is in the works, but the rest of the specials will be on. Is there going to be a 15-day limit for student absences? Great question. The attendance, I understand, is is one of those things that we're concerned about. I can assure you we're not going to call the magistrate or do any of that during this pandemic. We want you to use your best judgment. We want you to keep your kids home if they're safe. If we're running into issues where we're getting up there, then we may talk to you about a different option that may be available. If they're going to be home for an extended period of time, maybe a different option would be beneficial to them, with a doctor recommendation. We can do that. But if they're missing a couple of days here and there, we understand, and that's okay. And there will be an understanding about that. Because we are asking you to do a lot as far as symptoms check and things like that. Am I taking away the 15-day limit? No, not technically, but understand that, we're very flexible on that. If there is a full closure at some point, will Wayne Highlands teachers all go virtual and stream live as in option 1? So if you look at our plan, it will be Google Classroom. The streams, when we're in red, the streams right now, I don't think are happening. I think it will be a Google Classroom, but I'm going to be honest with you. I have to check into that one. But you will be informed of what the plan is. Now we usually go, if in the past, usually I say we go green, yellow, red. If we go to yellow, we have that plan that can be discussed further, and you can look that over as far as staggered days and things like that. But, as far as going red and those being streamed, I'm not sure yet. And I think that is under discussion also. So thankfully we're not there, and we'll have answers for you as we get closer. What will it look like for kids who have extra support in school, such as speech, Title I, and IEP planning? That'll be handled through the special education department. You are definitely welcome to call me. And I can get you in touch with them, or I can answer anything that I can answer personally. But there will be accommodations made, yes. And for speech, I can tell you that there's protective barriers up. They will be pulled out of class, and they will be going with the same people all the time. Title I, same thing. They will bring their seat backs with them from their classroom to Title I, so they don't have to use different books when they go to Title I. So there'll be no sharing of books there. IEP planning, that will be handled through the special ed department. And if you have questions on that, just let me know. Thanks, Ashley. What if a student is having a hard time wearing the mask? Are there disciplinary actions for the students? Nope, we're not going to throw them in jail. It's a teachable moment. They're kids, 5 to 7, and we just have to teach them. We have to let them know. If it becomes a chronic issue, I'll get in touch with you, and we'll talk about maybe some ways we can solve the problem. But it's not. I'm definitely not going to be keeping them in from recess or doing anything like that in the beginning, because it's so new to everyone and they're so young, and we just want them to have a good experience when they come. We want to set that tone for the rest of their school career, and we don't want that tone to be COVID mask detention, So, we will be very lenient with that as it comes about. Let's see. Will an adult need to be with a student in option 2? Not necessarily. No. If that student is able to complete the work on their own, that's fine. If they're going live, that's fine. They'll have the teacher there. So no, you won't need to be present. I would, as a best practice as parenting, if they have questions, obviously you would be available to answer them. Or if they're live, the teacher would be there. How will parents be set up for pickup so they are not clustered at the doors? Great question. We did talk about that a little bit. Once I get that bus schedule in and the transportation schedule, we're going to decide on that pickup time, and those kids will be separated, socially distanced or with masks and 3 feet at least, and we'll have them in separate areas probably is what we're looking at right now. We're not set in stone on that one yet because we don't have the transportation schedule yet, but good question. Thank you. Will they be able to utilize the library and technology for those specials? We're looking at it, but library and technology will be delivered in the classrooms. And that's to avoid, that transition period when they're up out of their desks and moving around the school. We're trying to stop that as much as possible. The movement in the classroom is okay. Those wellness breaks, those times when they need to get up and stretch, those mask breaks. But as far as moving around the school to specials, we would rather have the teachers and the health experts had advised us that having teachers come into the classroom is a better option. Will the kids be bringing books back and forth for homework purposes? We are trying to either alleviate as much homework as possible, or the homework they're given will be done and possibly either submitted digitally or just shown to the teacher. So there's a couple different options we're looking at as far as back and forth between homework. But our goal is mostly to get the students in. Our main concern is not the homework right now because we don't want to transfer the material so much, but we do want them to have a little bit of extra practice. So some of those things might be not your typical homework assignments that you normally see, but maybe something that they do on their own just to encourage them to keep practicing. If a student tests positive, what happens to the rest of his or her class? Again, we're leaving that to health officials. We will be, we'll isolate that child quickly. If we do see symptoms, we will isolate the teacher. We have an isolation area that the nurse will be utilizing if there are symptoms. And then we will get with those health professionals to get you some answers to what the next steps will be. If option 2 is picked, will textbooks be provided for the students or will it be all digital? It will be all digital, no textbooks. We're looking at not even textbooks for the most part in our classroom, like our math being projected and things like that. For option 2, you said all digital. Will they be clicking and typing through assignments? Will there be written work to submit as well? Also, will be specials be offered? Yes, specials will be offered. I did say all digital. Will they be clicking and typing through assignments? If they're live, it's probably just going to be interacting like the other students do, or not probably, it will be interacting just like the other students do, where maybe they're holding up a board with their answer on it and the teacher could see and just check quickly for understanding from each student. If there is an assignment due, and they want to handwrite it, the option would be there for them to handwrite it. You take a picture and upload it to Google Classroom. There are different options and we can explore those with you. And if you have specific questions, I can answer those for you. Internet difficulty. Can everybody hear me? I got late to that one. I'm hoping everyone could hear me all right. I think Mr. Miller would have told me. Will students have access to teachers outside of synchronous lessons? Great question, and I'm sure my teachers are listening to this also. There will be, the teachers will be contracted through the day, right? So the expectation is not that teachers will be answering questions throughout their evening before they come to school. Once that question is answered, they will do their best to answer it that day. If not, it will be answered when they come back to school the next day when they have the opportunity. Will some teachers decide to answer? Probably, but we are not asking them to do that. Families choosing option 2, will lunches be provided for children? And that is being worked on through Mr. Spalding and our cafeteria staff, and the whole district is working on that, on how to deliver food to students who will need it if they are choosing that option. But something will be available, yes. Extra sneakers for gym, would they be allowed to stay in cubby? Yeah, I don't think that's an issue. I think if we have the cubby space, your teacher will let you know. I will talk to them about it, but if we have the cubby space, I don't see an issue with that. Yeah, I talked about the access to teachers. What about specials for option 2? Yep, we talked about that. You can go back and look for the sake of time if you want. It'll be posted. This whole Zoom will be posted on our website. But yes, they will be streamed. And Jim, I talked about, we're looking at that. You have access to free educational learning sites like we did at the end of the. Yes. We are looking at some sites that that the teachers have asked to use because they were exceptional and and they worked well for them. So yes, we are looking at reading sites, and we are looking at, if we need to get subscriptions or we need to use the free sites or whatever we're going to use there. But any of that information will be given out to you. Links will be shared with you throughout the year if you're choosing the at-home option, to know where to go and what to do. And some, as we come across different things, we'll share them with you. And we'll let you know for those at-home students, I can put out an email blast with some of those links every week and let you know what's coming down the pike, and what you can use to help your student. Let's see. If the colors change, will option 2 stay at home stay the same if we go yellow or red? Yes. Yes, you will still be at home. The delivery of the instruction may look a little different in red, but yes, you can stay at home. You can stay on there. If option 2 is picked, if my child has a question, will they see my child clearly so they can build and connect and raise their hands? Yes. Also, are there any special steps being taken for children with asthma, particularly children when it comes to more severe cerebral autism? Yes. And like I said before, let Mrs. Howell know if she doesn't already, and she will be adamant about checking in on those students and making sure that everything's okay. Teachers will know too, to make sure to keep an eye on those kids. The other part of that question, yeah, so if your child has a question and they're live with that teacher will be checking that screen too. So they'll know if there's a question, or there's, and as some of you are familiar with Zoom, there is a hand raising feature on it. If they have a question, they could put it on there, and I believe it might even ding for them, so they'll know that there's a question. So if a child is ill or has to stay home and they do the Google Classroom for that day, will they still be marked absent for that day? Good question. That's one I'm going to have to think about a little bit. I haven't hit that question yet, so I apologize. But if there's a way for them, since we're looking at completion of work on Google Classroom, and a student is home for a day, yeah, I believe they will be marked absent as I think through it, because the option is there for them to go on the Google Classroom to get that material, just like it would be for them to return the next day and find out what they missed. So we would mark them absent, but they are still able to go onto that Google Classroom. For blended families, that the kids split homes, will it be an option for the kids to take a day off during the week and catch up over the weekend? So, looking for flexibility, like taking a day off during the week if you choose the traditional option and coming back. As far as traditional learning, no, I'm going to say, only because, if there's extenuating circumstances, we can work something out. Just call and talk to me about that, and we can talk through it and figure out what we have to do. But as far as me saying, yeah, they could take this day off and make it up on Saturday if they're traditional learning, well, we're not here Saturday, so I can't give that option, but I can definitely work with you on that if you need some help on that. Just give me a call or shoot me an email. Cloth masks are disposable, up to you. Can students be sent with extra masks? Yep, in their backpack, that'd be great. What about behavioral health? Will children still be able to have that? Yes, they'll still be working with us. So behavioral health, how that looks, I've been focused so much on the curriculum in that. I have been in touch. I think Jess is on here actually, but we're looking at how that's going to be delivered too. That'll be staggered, and all the social distancing guidelines will be present for that also. Thank you. You're welcome. Will children wear masks during gym or recess? So that is a great question, and I've been in contact with our phys ed teacher. And if you look at our health and education plan, as the athletes are exercising, they are not required to wear a mask. But when they're on the sidelines or moving around, things like that, they have to have masks on. That's something that I'm looking into. I have started looking into it. I would hope that we were able to distance them enough that they wouldn't have to. But again, I wish I can give you a definite answer, but we're still working on that one a little. Thank you. How will students turn in their work in option 2? That will be through the Google Classroom. That would be your live learning. School shut down fully because our problems. Okay, I'm gonna have to read through that one. So in choosing between option 2 and 3, one concern is continuity. If schools shut down fully because there are problems statewide, option 2 seems more challenging since the teacher would likely go to Google Classroom versus live video classes, where in option 3, there would be no transition. Is that an accurate assessment? So the question is, if we go full red, is that an accurate assessment that, you know, teachers won't be streaming any lessons? And as I said before, that is something that I'm checking on as far as, you know, teachers streaming if we do go into the red zone, or the red phase. The benefit, like I said before, is the Google Classroom is there, the opportunity to put videos are there, and it is our teachers. So, you know, if you're looking to go into VLN just for that reason, I would caution you, because we may not even get into the red. You know, so with the way things change and the way things are going, who knows? But I would caution you on making a decision solely on that purpose, because I'm confident the delivery of the instruction will look different than it did last spring in the Google Classroom. If there's a snow day, how will that work for option 1 and 2? Option 1, you're home. Option 2, you're home, you're live. That's a snow day. Teachers are not instructing. Kids are home. Can we send them in 2 or 3 days and do distance learning? I think I discussed that a little bit before. We're looking for that full on 5 days. The workbooks were very helpful. If we are doing distance learning, can the math and ELA workbooks be provided so we don't need to handwrite the problems? That's an option. Yes, we can do that, and we can do a pickup for that if you are going that route. I would have to talk to the teachers though, because I know a lot of them are looking at the digital component even for their classrooms. So will they be utilizing the workbooks as much? I believe they probably will be, but we can definitely get those out to you if you choose that option. So yes. Assume there are not snow days in option 3 and school would start and end on time. Well, that's a good question. And that would be a question for Mr. Roos. And I will ask him that. I'll shoot him an email, and he will be able to answer that as far as VLN goes if they're on during those days. Singing is problematic. Can we opt out of music? Will students eat in their classroom or use the cafeterias? Is option 3 asynchronous? I believe option 3 is synchronous. Again, I have to put that out to Mr. Roos, but I can get you the answer to that. Singing is problematic. Yes, we do know that. That's why, you know, I talked to Mrs. Moyer about the concerts and moving them to the spring, and there won't be chorus practices during this phase when we're starting. That may change as we get through the year if things ease up, but right now there's no chorus. And when they get into the music classes, we're looking at general music, instruments that will be disinfected if they use, and if they're going to sing, they'll be socially distant with masks on. Will the students be graded on all subjects if option 2 is selected? If kindergarten last year we did subjects. So option 2, yes, they'll be graded on their math, everything that is taught in the classroom. It will mimic. So yes, that will be there. As far as assessments go, that'll be worked out by grade level, and we'll let you know how those assessments will work. Let's see. Okay, so Patty, I know there's a question here. It's actually our last one, if you're still there. The evidence against checking temperatures upon arrival at school. You know, I'm gonna say, you know, the evidence shows that. Well, if Patty, are you still there?
Yeah, I'm still here.
I don't want to. Yeah, do you want to go to that?
Yeah, no, I can speak to that for sure. taking a temperature and a temp of 100.4 obviously is, you know, it's a sign that they could possibly have the virus, but it's a sign of many, many different things. And the biggest thing with us not checking temperatures when they first arrive to school is, well, we're really encouraging parents to do those, you know, checks before you send your child off to school. But also a lot of these kids, I mean, we're all parents here. We know how mornings are. You're on the bus, you're rushing, you're coming into school. And if we checked a temperature on every single child coming in, there would probably be several every day that might be 100.4 or higher. Then we'd have to take them and sit them, and they feel fine. We'd have to take them and sit them for 20 minutes just to recheck them. And 9 times out of 10, you know, or their temp would be normal, if not all of them. And so then we're kind of just the flow coming in the building. And again, if you look at the literature, and it's just not best practice. So that's why we made the decision to do that.
Thanks, Patty. I think I went through all of them. Did I make it? I think so. All right. So, you know, in closing, I'd like to thank all of you. It's been a long meeting. It's a long time to sit in front of your screen. Trust me, I know we've been doing Zoom meetings, I think every day, 6 of them as a district. So I get it. And I get it on your decision. It's a family decision. It's a decision that you shouldn't take lightly. I do understand maybe some of your reservations coming back, whether it be wearing the mask all day or whether it be, you know, the health and safety of your own child. And I get that. It's new to all of us. But trust that we have worked hard to make this as seamless as possible and as normal as possible for the kids and the staff. And we want to work together as a community. And I hope that we can do that. I hope we can get past a lot of the, you know, the arguing and the this and that, and let's come together for our kids.
Tony, which person would we reach out to for further questions if it pertains to policies and decision making on choices 1, 2, and 3? Would it be directly to you or go to the district administration? Sorry,
I was on mute, I think. But yeah, if you come to me, you can get it to me, and then I can get you to the appropriate person. If it's about VLN, I can get you in touch with Mr. Roos. But if it's about, you know, the traditional or the live program, I can answer most of your questions. So if you have some, feel free to call me, email me, whatever you want. Like I said, I'm here usually 8:30 to 3 at least every day. So. All right. So again, like I said, thank you very much. I'm not going to belabor it too much. We're hoping to see your kids. If any of those kiddos are out there listening, we can't wait to see you. We miss you. I know you miss your teachers, and you know, let's enjoy the rest of the summer, and let's look forward to coming back because we're ready to go. Thank you for your time. Give me a buzz. Shoot me an email if you need anything. Have a great night, everyone.